An Introduction to Radiology Part 2. How to use cross-sectional anatomy as part of your gross anatomy education. Just like your first week in learning gross anatomy, we need to orient you. How do you look at these images? For the most part, whenever you look at a chest x-ray, an ultrasound, a CAT scan, an MRI, any type of radiological study, the patient's right side will be on your left. The easiest way to think of this when looking at a cross-section is to always imagine you're looking at the patient as if you were at the foot of the patient's bed and you're looking up at the patient. CTs and MRIs are viewed in this manner. If you remember this, it'll make your interpretation of the radiographs much easier, and it'll help you to make sense of the anatomy and to not make silly mistakes. So let's practice. Here's a cross-section of a cadaver through the upper abdomen. The patient's right side is on your left, and the patient's left is on your right. Again, it's just as if you were at the foot of the bed looking up at the cross-section. Here in this image, the dorsum, think of a dorsal fin of a shark and you'll never forget what dorsal means. So here in this image, the dorsum of the back is lying on the bed, and the ventral surface, or the belly surface, the anterior surface of the abdomen where the belly button is at the upper aspect of the screen. Orient yourself this way and you won't get confused. Remember, the patient's right is on your left. If you ever watch episodes of Scrubs or Grey's Anatomy, or for that matter, most any other medical show except for ER, which always gets it right, whenever they hang x-rays, they're usually hung backwards, upside down, everted, just wrong. You won't make that silly mistake if you follow these rules. We throw the word CT scan around a lot, but what is a CT scan? CAT scan stands for computerized axial tomography. CT or CAT scan is a way of taking radiographic images by moving a focal plane of film and moving the direction of the x-ray together in sync 180 degrees apart. The film remains stationary in sync with the x-ray source, which is moving back and forth. We can actually blur everything out except for certain structures remaining at a fixed focal point. Have you ever looked through the eyepiece of an expensive camera and noted the camera was focused on the faces of the family while the background was blurred out? It's the same idea. If we do this, and we do this hundreds of times a second rapidly, we find that we can image structures using a computer, generating thousands of images, thousands of pixels. Perhaps the best example, look this up on YouTube or on Google, look at a study called an IVP. IVP stands for intravenous pyelogram. Basically, this is a tomogram focused on the kidneys and the collecting system of the human body. Here's an excellent example of tomography. It's an example of an IVP. You can see the kidneys, the ureters, and the bladder, but all other anatomical structures are blurred out. Here's a picture of a CT scanner. The patient is lying at a fixed focal point. As the patient moves through the scanner, the focal point changes, and it allows for the CT scanner to refocus on each body organ at each new focal point. Nevertheless, as she moves into the scanner, the X-ray detectors are spinning around her. The radiation sources lie across from the digital radiation detectors. Think of it as digital film that will sample each image. The computer reconstructs each image, creating multiple tomograms, hence computerized axial tomography. Taking the cover off the CT scanner shows you the spinning set of digital radiation sources and detectors. Looking at the middle photo, the graphic detail in 3D images is indeed stunning. As opposed to the radiation source used in CT scanning, MRI technology uses magnets. MRI technology was originally known as NMR, nuclear magnetic resonance. You remember this from your days in organic chemistry. NMR technology has been around longer than CT scan technology, but was only relatively recently placed into use for imaging. Here we see three types of MRI scanners. The one on the left is the closed MRI scanner. The right is an open scanner. And the newest addition in the center photo is an open upright scanner. Open scanners usually have magnets and produce images suffering in resolution. They're not as strong and the image quality is not as good. Closed MRI scanners, which generate a better picture, are usually quite claustrophobic, hence the reason many patients need sedation. Patients who are severely claustrophobic will do much better with an open MRI scanner. So let's take a look at the imaging technology an MRI scanner can give us today. If a patient complains of back pain or musculoskeletal pain, they will usually benefit most from an MRI scan of their back or spine. MRI is the preferred imaging modality for musculoskeletal complaints. Why? It's based on water content and proton spin, and muscle tissue has a lot of water. Here we see sagittal images of the MRI of the spine. The data, however, collected from the MR scanner can be reconstructed by a computer to give us sagittal, transverse, or coronal images. In fact, while thousands of slices are generated, we can create any type of anatomical plane to look at the anatomy or the pathology that's necessary. Even an oblique can be reconstructed. Here we see the vertebral body, the normal disc spaces, and a herniated intervertebral disc pushing into the lower spinal column. This is technology given to us through Nikola Tesla's work in electricity, magnetism, and Fourier transform analysis. This technology, which relies on water density of body tissues and changes in proton spin detection, allows us to learn anatomy using cross-sectional images and provides spectacular images. Another example of cross-sectional imagery is breast ultrasound. Breast ultrasounds are done in surgeons' offices all over the country. It's just another way of learning and seeing anatomy without cutting somebody open. Here, ultrasound is used to assess different layers of a woman's breast. At this point, it's not important that you can read the ultrasound. Just know that multiple cross-sectional images are interpreted in order to evaluate for breast pathology and abnormalities. In the images that we see here, the image on the left is normal breast tissue. The upper right shows a very irregular density, highly suggestive of cancer, as is the image in the lower right, also highly suggestive for cancer. On the right, cross-sectional images of the head, a CT scan of the head, while on the left, an image from VH dissector showing a cross-section of the cadaver's brain. This is impressive technology. In Arizona, we're lucky to have one of the premier institutions for neurosurgery and neurological care. Barrows Neurological Institute at St. Joe's Hospital in Phoenix is perhaps one of the foremost neurological research and surgical institutions in the world. There, every day, cross-sectional images are used along with stereotactic images to localize and treat brain tumors. Still not convinced about the utility of cross-sections in your anatomy education? On the right is a CT scan of a patient's thyroid. In the center of that image, on the right, is a trachea. This thyroid has grown around the trachea and is compressing the esophagus. That's where the red arrow's at. It's trying to show you where the esophagus should be. On the left, we see an image from VH Dissector Pro showing the trachea, a normal trachea, and a normal thyroid, and below we see a wide open esophagus. It's labeled by the large black circle. The images in the lower right show large thyroid nodules found incidentally on scan. How would you report these incidental thyroid nodules if you were a medical student or a radiology resident? Again, cross-sectional images. This is the way you're going to see anatomy the rest of your career. You might as well get used to it and try to learn how to read these images. We've spoken about ultrasonography of the breast. Here, there's ultrasound of the thyroid. You just saw a CT scan of the thyroid in cross-section. Now, with ultrasonography, we see another way in which cross-sectional images are used. The trachea is in the center, and the thyroid gland is seen overlying the trachea. I've labeled it, the right thyroid lobe and the left lobe of the thyroid. What's a pulmonary embolus? Well, that's when a blood clot gets caught in the pulmonary artery and it prevents the flow of blood into the lungs. Sadly, the patient can't get oxygen into his blood because the blood flow to the lungs is blocked by a blood clot. Here we see an arrow showing the clot in the pulmonary arteries. That's called a pulmonary embolus. In my career, we used to use radioactive nuclear medicine scans called a VQ scan. The V stood for ventilation and Q was short for perfusion, to diagnose pulmonary emboli. But today, the technology of CAT scanners is so good, the resolution is so high, that we can diagnose pulmonary emboli by using CAT scanners. And the way that we interpret those images? Cross-sectional anatomy. If you don't learn cross-sectional anatomy, you're going to be at a loss as a clinician. More cross-sectional imagery. On the left, 1 millimeter cuts from the cadaver and VH dissector. On the right, CT scan of the chest, again showing a large pulmonary embolus, noted by the two large white arrows showing the blood clot into the right and left main pulmonary trunks respectively. I spent about 15 to 20 years of my life almost daily looking at cross-sectional images of my patients. The pathology is tremendous. Cross-sectional anatomy is necessary for any surgeon, or for that matter, any clinician, to learn anatomy and pathology of the abdomen, the chest, the pelvis, even the extremities. Click on the link here to view an entire whole-body CT scan of one of my patients who is suffering from breast cancer. In this case, the CT scan was done to look for any metastatic disease. Metastatic disease means disease that has spread into other areas of the body as a result of a primary tumor. Here again on cross-section is an abdominal ultrasound of the liver. Multiple images will be obtained, all in cross-section, as defined by the cross-sectional beam of the transducer of an ultrasound machine to help us look into the body. Cross-sectional images from a CT scan, an MR scanner, or an ultrasound. In this case, we're looking at images not only of the liver in the image on the left, but we can see an ultrasound image of the kidney, and on the right, an ultrasound of the pancreas with the various anatomical areas labeled. It's all cross-sections. Again, we see an image from VH dissector on the left, and on the right, we see an image taken from a CAT scan. The cross-sectional image of the cadaver's pelvis and the one on the right, the CT scan of the pelvis, shows us the uterus. On the right, the uterus is labeled, as are the two ovaries, and the patient has a right-sided ovarian cyst, labeled by the red arrow. By comparison, there's no obvious pathology in the cadaver image, but you can see the anatomic resemblance on cross-section. To help orient you, here's an image of the uterus and ovaries, how it normally would look. Ultrasound of the breast, ultrasound of the thyroid gland, ultrasound of the abdomen, ultrasound of the pelvis. Here we see transvaginal ultrasound. The blue arrow shows the apex of the uterus with a small amount of fluid superior to the uterus. The uterus is noted by the yellow circle. The red arrow shows the endometrium of the uterus, known as the endometrial stripe. Again, even though it's an ultrasonic image, it's a cross-section. To help orient you, look at the image on the right and you'll be able to identify these structures. With practice, time, study, and correlating each image with the physical exam finding on your respective patient, you'll become a better clinician. Remember, look at every single image you order on your patients and find the time to share those images with them. It builds trust and it will make you smarter. Well, I hope you enjoyed these two short presentations on cross-sectional anatomy and the importance that cross-section plays not only to your anatomy education but to your future. If you're interested, stick around for a few quiz questions. The quiz questions were written to reinforce those ideas and topics that I thought were important.